abuse. Physical discipline has roots in the Bible. Most parents do not intentionally injure their children. Psychological and sexual abuse, neglect are as damaging as physical abuse and protected from civil and criminal liability as long as there is no false report. Now, when we look at this, 1/10 of all abuse is sexual, and 80% of the perpetrators of child abuse, maltreatment, is the parent. Violent behaviors. Psychoanalytic, basic instinct of displaced self-destructive impulses. And interpersonal, they think it's more with the personality disorder. Biological, they say it's neurologically based instinctive drive, and social learning theorists feel it's aggressive behavior versus part of a socialization process. Definitions of child abuse and neglect. The abuse is harmful treatment. Negligent treatment, acts or omissions which are intentional or willful. Physical injury is the most visible form of mental injury. Abuse takes a toll on the self-esteem, and sexual abuse is forcing of undesired sexual acts by one person to another. Definitions of child abuse and neglect. Sexually explicit conduct, obscene visual representations of sexual abuse of children. Child molestation, undesired sexual acts by one person to another. Sexual exploitation, formal child labor and abuse. And incest, sexual activity between family members who would be forbidden either legally or socially to marry. Sexual abuse is an abuse of power. The average age of onset is 8 years old. It is uncommon for children to admit to being sexually abused. Effects can be devastating and lifelong. It includes commercial sexual exploitation, and the most common form is between father and daughter. Shaken baby syndrome is a violent shaking by extremities or shoulders. The classic signs include retinal hemorrhage and intracranial injury. Infants will present with respiratory difficulty, and it is difficult to diagnose because of the vague symptoms and the very unreliable history. Usually it is not recognized by nursing and other healthcare professionals. Munchausen syndrome by proxy. The parents cause illness and then seek care, and the mothers are most often the abusers. There's reason for causing the child's illness is not understood, and the child usually is removed from the home for their own safety. Community violence. Epidemic in many urban communities. Gang membership meets unmet needs in the children, and the needs includes belonging, excitement, protection, money, food, drugs, or shelter. The extracts high toll on children, families, and community, and a high percentage of runaways have had some form of abuse. Know these definitions of rape: criminal sexual assault, aggravated criminal sexual assault, forcible rape, statutory rape, sexual battery, acquaintance or date rape, spousal rape, stranger rape, or gang rape. And rape usually is a crime of anger, degradation, and domination. Intimate partner violence. It is of power and control. It is a common pattern in repeated cycles. Phase 1 is the tension building phase. Phase 2 is the acute battering incident, and Phase 3 is the loving reconciliation. Violence is based on concept of learned helplessness, and women who stay are at a greater risk of being killed by the batterer. Elder abuse. Financial abuse is the most common, illegal or unauthorized use of a person's property or money. Physical abuse is hitting, punching, slapping, burning, pushing, kicking, restraining, false imprisonment, or confinement. Passive physical abuse is depriving a person of food, heat, clothing, or comfort. Psychological abuse is ignoring or humiliating a person and threatening to put them in a nursing home. Sexual abuse is sexual activity without consent and violation of rights, denying the civil and constitutional rights. Nursing perspective on abuse and neglect. When we look at the self-care deficit theory, nurses assist the client until client can engage in their own self-care. Crisis intervention theory, 4 phases that can last from 1 to 6 weeks. Assessment. They must know the symptoms of abuse and must know the characteristics of abusers. Interviewing and looking at the physical exam. Legally mandating collection procedures. Restraints in elderly, though, increases the risk of pneumonia, urinary problems, and thrombosis. Nurse and diagnosis. Anxiety, acute stress disorder, post-trauma syndrome, post-traumatic stress disorder, and other diagnoses depend on injuries. Outcome identification must be developed in conjunction with the client, and be careful to avoid projecting personal opinion and desires on the client situation, and remain as impartial as possible. People have a tendency to seek help in a non-judgmental environment. Help them get the help that they need. planning and intervention, require input from the patients and survey of resources. Primary prevention reduces or controls the causative factors. Secondary prevention involves early detection and treatment, and tertiary prevention is to provide appropriate services. And education would be considered part of the primary prevention program. It is directed toward the community to stop child abuse before it occurs. An evaluation, continuing assessment of the client, and look for changes in the behavior, the attitude, the family circumstances. Consider progress toward the goals and evaluate the coping mechanisms, and redirect the client to more effective strategies.